You make my world a better place. I can depend on you.
Hey guys, come on through.
On the Gold Coast, a distressed puppy is being rushed in,
Oh, he's shaking, little chap.
and Dr. Alex urgently needs to find out what's happened.
What's your little puppy's name? Hendrix. Hendrix.
The puppy has been viciously attacked by an 80-kilogram bull mastiff. His owner Melissa was so badly injured trying to break up the fight, her sister Alexandria has had to take over and get treatment for Hendrix.
She's so concerned about her puppy. She didn't care about herself. She didn't even want us to take her to the hospital. She was like, just take the puppy to the vet.
On talking to Alexandria, I find out more of the real story. Melissa, who is Hendrix's owner, is in hospital. She tried to get Hendrix out of the jaws of the other dog.
It's all right.
She's been badly injured and she might even lose a finger. I can only imagine how frightening that experience must have been, but it just shows you what people will do in that situation to save their pet. And it just pinned him down? Or...
Oh, we don't know.
God, that must have been traumatic for you. You did really well to get here. And what we're going to do with little Hendrix now is give some pain relief. We need to try to get him to feel a little bit better, and he's shaking and in shock at the moment. Let's assess his injuries and then we can work out what we're going to need to do to help him. All right?
I think I'm still a bit in shock. I wasn't expecting to hear my sister scream like that. I don't think it's registered yet. The whole thing about what's gonna happen to my sister. I don't know if she's okay. I don't know. We just left her and brought the puppy here.
This is such a challenging situation to be faced with. I've got a really upset family, a traumatised little puppy, and the possibility of an unknown number of injuries.
Good man, he's a good boy. Hi, Papa. You okay?
Hello.
In Bondi, Sue and Maritza have arrived with two sick rescue cats, brother and sister Boho and Tiny.
You can see her eyes glazed over.
We're worried because they've got symptoms like runny nose, runny eyes, sneezing, a bit of coughing, and they're just a bit grumpy. Yeah, poor little things.
Hey.
The 12-month-old siblings were found as kittens, dumped at a local cemetery. Both were suffering debilitating cat flu that they haven't been able to shake.
Hello, you guys.
Hey,
how are you?
Good to see you.
Yeah, you too.
Thanks for seeing us.
Good to see you both again.
You too. Mwah.
Who have you got for me here?
Tiny and Boho today.
Okay.
Chronic flu.
Right.
Yep.
Let's go check them out.
Okay. Excellent.
These cat carers are just priceless. They're absolutely unbelievable. They day in, day out rescuing cats. They see the worst of the worst cases. So now Boho is the boy?
The boy, yes.
Okay.
Yeah. He's got a running.
They're gorgeous.
Let go of me, darling.
Hello.
And I'll get Tiny out here. Come on, sweetie.
So let's have a look at them.
Okay.
So he obviously gets quite weepy eyes.
Yes.
He's actually got some chronic damage to the cornea, presumably caused by feline herpes virus or the cat flu.
Yeah.
Kate needs to put a special dye in Boho's eye and take a closer look under ultraviolet light.
What we really want to establish here, is this an ulcer or is this a scar?
An untreated ulcer could lead to blindness.
But I can see he's a pretty sick little cat. I think we just start with some vital signs.
Yeah.
Then we'll go over him, see if we can work out exactly where he's been attacked.
On the Gold Coast, 3-month-old Hendrix has been savagely attacked by an 80-kilo Mastiff. His distraught owner Melissa is in hospital with severe wounds after trying to break up the fight.
Oh, his heart's racing. I really think that's just got to be the shock.
Now that the distressed little pup has been given pain relief, Alex and vet nurse Kate can start taking a closer look at his injuries.
Let's try and get this collar off if we can. Really want to check him all over, see exactly where these puncture wounds are and how bad the damage is.
Oh, it's okay. It's okay. See them, hey? Stand up, hey? Yeah. He really doesn't want to stand up, does he? Let's have a look under here. Hey.
Little ones here, but they're very superficial. They don't even fully go through the skin by the look of it. I'm looking over Hendrix and I'm seeing some red marks, but I'm not seeing any deep puncture wounds. And that's surprising because Alexandria is telling me that Hendrix has been attacked by a much bigger dog.
Yeah, I'm thinking we're actually going to have to clip his hair off to make sure that we're not missing them because I can't see them. Oh, what's that? I'm just going to clip that hair away from that area. Oh, there we go.
There's wounds there, but they're not full thickness puncture wounds. You can never be complacent with dog bites. We're going to need to clip further and make sure that there's not more damage there.
Here are your bite wounds.
Good girl.
In Perth, Reese and Annika have brought in their 6-year-old Border Collie Aspen to see Dr. Peter Ricci.
That's it.
Hey, mate. How you going, buddy? And this is Aspen. Hello,
Yes, this is Aspen.
Hey, sweetheart.
We got Aspen when she was 9 months old. She's usually pretty healthy. We just noticed her eye was a bit irritated. It was just watering a fair bit, and we thought it was a scratch originally, and then it just didn't seem to get any better. Just kept irritating her. Unfortunately, she's got a grass seed stuck behind her eye, embedded in the skin.
With grass seeds, depending on where it goes, they do tend to go down behind the third eyelid,
Yeah.
typically. Is that where you saw it go, like, towards the nose?
Yeah, so it's like in the corner,
Yeah.
behind the eye.
Aspen's got a grass seed stuck in her third eyelid. This definitely could be something a bit more serious than it first looks. Grass seeds tend to be nasty. What I'll do is, no, sweetie. I'll put some local anaesthetic in her eye so that it will numb it, and then hopefully with that I'll be able to retrieve it out. Often they actually ulcer the eyeball as well, so I'll stain her eye and have a look at that and just see if there's an ulcer or not. If the grass seed's been there for a couple of days, then we have potential for significant trauma and life-threatening infections. If it's a bit more complicated than that and we need to give her a sedation, I'll come and have a chat to you, but hopefully we can just do it with local. So, yeah. I know, sweetie. You're beautiful.
She's pretty tough. She never complains when she does hurt herself.
Let's go, Aspen. Come on. Come through.
Obviously, she's in a bit of pain, so she's probably realising that we're trying to help her. So hopefully it's not too difficult and hopefully it's not too uncomfortable for her.
Good girl. All right, so I'm just going to put some local anaesthetic eye drops into her eye. So that should numb her eye in a little bit.
All done.
So I think the local anaesthetic's starting to take effect now because she's opening her eye a little bit more. Now I'm able to get a really good look at Aspen's eye. I can see that in her third eyelid, there's a nasty grass seed poking right into it. It's clearly causing a lot of pain and there's a little bit of blood coming from it as well. All right, so I can see the grass seed is just attached to her third eyelid there. I really need Aspen to stay still so I can remove the grass seed out without causing any injury myself. If she moves around while I'm poking tweezers into her eye, that could be quite risky. I know, sweetie, it's okay.
There you go, little mate.
In Bondi, Kate is worried about rescue cat Boho after he was brought in with his sister by rescuers Sue and Maritza.
So he's going to have a little fluorescent eye, and what it does is it just lets us look for damage on the cornea.
Yep.
Both siblings have been battling ongoing cat flu, which can often lead to nasty eye ulcers and long-term damage.
And lets us be able to establish if we actually need to treat that ulcer.
Okay.
So what we can see here is that there's actually not a great deal of fluorescein uptake in that eye. So this is actually a scar, right, over the cornea. It looks like it has been an ulcer at some point and it's actually resolving. There is, however, some secondary conjunctivitis in these eyes, right? So we still do need to use some antibiotics to sort that out. It's a real uphill battle for rescue cats. These things reoccur, they get sick, they get skinny. It's just a vicious cycle. cat flu. Affects the ability to be able to smell, right? And without the ability to smell, they just don't eat very well. So trying to keep his weight up is going to be a bit of an ongoing battle.
Okay.
Find something you really like.
Yeah. Roast chicken.
Roast chicken.
Or smelly fish. Smelly fish.
Yeah. Swap.
Swaps.
Swaps.
Swapsies.
Hello, beautiful. How are you?
She's tiny, isn't she?
She's a lot more chilled than what he is.
Yes.
Like her brother, Tiny has also been battling cat flu most of her life.
You can also see that little left nostril is just so snotty. Yeah. She can't smell.
No.
Right? Oh, dear. Gosh, that's a bad eye, isn't it?
You should have seen it when I found her.
I can't actually see that there is anything actually wrong with those corneas, which is great. You do actually notice a prolapse of that third eyelid. So the virus has at some point really damaged those eyes. It's been an ongoing battle to get these two little guys over their cat flu. Today what I'm going to give them is some antibiotics, and we're going to also send them home with some antiviral medication. It's really strong. It's a lot stronger than what they would have used before, and I think this is going to be the thing to kick it. 20 days of antibiotics.
Okay.
I know it's a long
That's all right.
stretch.
Sounds like they need it, absolutely.
You know, these guys have been sick for a really long time.
Yeah, that's right.
They've got really chronic infections, and we really want to try and actually get on top of it. I'm not sure that Boho and Tiny are ever going to find long-term homes, but Maritza has a real soft spot for these two. She's cared for them since they were tiny, and I reckon that they've probably got a home for life. You're a good boy.
I think we really want to clip up this area here because this is where I was really worried.
On the Gold Coast, Alex and vet nurse Tiffany are urgently trying to find any puncture wounds on dog attack victim Hendrix.
Can you clip that hair off?
Oh yeah, look at that.
Yeah, that's a tooth mark. That's just gone right through. We're definitely going to need to look into that, clean that out. There's a deep puncture wound from a tooth, and that fits in with exactly what Alexandria's been telling me, which was that Hendrix was bitten across the stomach by the big dog.
12-week-old Hendrix was viciously attacked by an 80-kilo bull mastiff.
One thing I'm worried about is whenever you've got one puncture wound, there's often another one the other side of the bite.
From that full grab, both sides?
Yeah. So we're going to have to keep looking and see if we can find any more.
I just need to do a little bit on your
you
other
roll him
side,
over?
baby. Look at that bruising already.
Yeah, you can actually see that. Can you see that, where that's all swollen? Big concern with dog bites is that if a tooth pierces through into a body cavity, it can damage organs, it can set up nasty infections. That's what we're really worried about. I think that's the other side of the grab.
Where he's grabbed him?
Yeah, he's got one tooth in there. This one hasn't actually broken the skin, but he's lifted that whole area off.
So bruised.
Yeah. This means that we're going to have to anaesthetise Hendrix and surgically explore this wound to see how deep it goes. Will you go over?
There you go, little monster.
In Collaroy, wildlife volunteer Joan has two little patients to see Dr. Lewis Hunt.
In here we have two wombat joeys. They're about 5 to 6 months old.
Both baby wombats were orphaned and brought to Sydney Wildlife to be reared by carer Joan.
My little babies, you won't see much with all the
not
bags.
much going on there.
We'll have to get them out for you to have a check.
That's good. It's very rare that I get to see wombats at this age. It's a fantastic opportunity to have a look at them. They're gorgeous little things.
So this is Wanda. So she's really gorgeous, isn't she?
She's amazing,
She's just the
hey?
most beautiful little baby.
Yeah, so at this age, they're normally well and truly in their mother's pouch. And obviously, it's sad that we're seeing them because it means their mum didn't make it. But, you know, without Joan's incredible effort, you know, at least we can get these guys hopefully back to the wild. They're just amazing. I mean, look at them. They are so cute. And obviously already you can see these adaptations designed for digging their burrows and all that sort of thing.
A quick check on the scales will indicate if the wombats are gaining the correct amount of weight.
Yeah, there we go. 16 grams. And there we go, Wanda, what are you? 1.42 minus 6 kilos, hey?
A dehydration check is also very important for these delicate little babies.
So we're just checking she's not dehydrated, so we just do that by just feeling behind their eyes, making sure that that's not sunken there. So that all looks good, and she's been well otherwise.
Yeah, she hasn't been too bad.
There we go, sweetheart. Let's get you back into your pouch, hey? We certainly don't want to keep these guys out of the pouch too long. The last thing we want to do is stress them out, but obviously we do need to check them over.
With Wanda getting the all clear, it's time to have a look at Waldo.
And he's got a bit of a sneeze.
At this age, these guys can be really susceptible to infections, and if if it is something nasty, they can go downhill really rapidly. Good girl.
In Perth, Border Collie Aspen has been brought in with a nasty grass seed embedded in her eye.
It's okay, Bobby.
Peter is worried about the deadly implications if he can't get it out.
Eventually they can migrate into places like in the chest, in the lungs and around the heart and cause infections that can kill the patient.
I know, sweetie. And I'm just going to gently try and remove it. There we go. And there it is.
Pretty nasty thing to have in your eye. If it had been in there for a couple of days, definitely an infection would have set in by this point and there would have been significant trauma to her eye.
So we're just giving her eye a little clean now. Oh, girl. So well behaved.
Now that I've got the grass seed out, I want to stain her eye because the grass seed itself may have rubbed against her eyeball and caused a corneal ulcer, so the outside layer of her eye.
Good girl.
So there's actually no uptake on her eyeball at all, so that's a really good sign. It means, oh, hang on, that there is a hole in her cornea.
Heavy. All right, Tiff, can you just help me get him up there?
On the Gold Coast, Alex has uncovered troubling bruising on dog bite victim Hendrix. She's now starting to fear the injuries under his skin might be extensive.
The first thing we're going to do is ultrasound Hendrix and make sure there's no evidence of internal bleeding with this kind of trauma. So just looking up under the diaphragm, around the liver. All I'm looking for is any free fluid. Generally in a trauma patient, if you're seeing free fluid in the abdomen, it's blood. The good news is at this stage, I'm not seeing anything like that. So hopefully we've got nothing to worry about internally, and we've just got to deal with these wounds. That looks really good, actually. It's good news, the ultrasound's clear and there's no evidence of internal bleeding. So now we're going to anaesthetise Hendrix and surgically explore this bite wound, see how bad it really is.
When Hendrix was rushed into emergency, it was with his owner's sister. Owner Melissa was so badly injured in the same dog attack, she's still undergoing treatment in hospital and has been desperate to find out what's happened to her beloved pup.
Hi, is that Melissa?
Yes, it is.
Hey, Melissa, it's Dr. Alex Hynes here. I'm the vet that's looking after Hendrix. He has got one puncture wound in particular that we're going to need to treat surgically.
Is it the one on the tummy that's bad?
Yeah, it's the one on the tummy that we're most concerned about.
I knew. That's when I panicked, when he got him on his belly.
Yeah, I'm hoping that the big dog has just picked up a whole heap of skin and that's
not
where...
like anything internal.
That's right, yeah, exactly.
Yeah, okay.
So, how are you doing?
I'm at the hospital because it might have gone through my middle finger. Like, I've got bite marks on all of my fingers. I'm trying to pull his mouth open.
Wow, Melissa, that was incredibly brave to put yourself between the big dog and Hendrix.
I'm just wanting him to be okay.
Yeah, I'll give him a big hug for you, okay? You take care, Melissa.
Thank you. Bye.
Poor Melissa, I just feel so sorry for her. She's worried about herself, her hands have been badly injured, and now she's also got to worry about Hendrix.
And there it is. That there is a hole in her cornea.
In Perth, Peter has just removed a large grass seed from Aspen's eye and must now find out how much damage has been caused by the sharp seed.
So just in the bottom right-hand corner, you can see as she moves her eyeball across, there's that little bit of green uptake. That is a corneal ulcer.
If an ulcer is left untreated, Aspen runs the risk of serious infection or even blindness.
It's only quite small and it should heal quite nicely, but considering how big that grass seed was, it's definitely going to be causing her a little bit of grief for the next few days. So I'm about to give Aspen an injection of a painkiller, anti-inflammatory. She'll go home on this medication for the next few days as well. This will help with the pain associated with that ulcer in her eye. Come on, Aspen. You can go home. Come on. Come on, sweetie. How you going? So it all went really well. So yeah, she's had the grass seed removed. Seeing Reese reunited with Aspen is a really good feeling. They're clearly happy to see each other. Reese was very worried about her, and the grass seed in her eye is obviously quite traumatic for him to see Aspen with that. As far as damage to her eyeball goes, there's only a small area of an ulcer there. Okay. Nevertheless, there is an ulcer, so we need to send her home with some pain meds because they're usually quite painful. Should be basically problem solved now that it's out. And
that's great.
Hopefully with these medications, it'll keep it that way.
Yeah, so, wicked.
Oh, she's winking at us.
Yeah, thank you.
Poor girl. All right, I'll leave you to it. Nice to meet you. This is one of the most satisfying things about being a vet.
Hello, Waldo. Sweetheart, look at you. So they're not brother or sister, are they?
No, but we try and pair them up so that they'll do better together.
Yeah.
Because we want them to go back to the wild. That's what we aim for, not to be pets.
In Collaroy, Lewis is about to give the second little wombat, Waldo, his checkup.
There we go. Good Waldo, hey? 1.37, so about 10 grams heavier than Wanda. Any nasal discharge that you've noticed, any?
Yeah, it's just been sneezing.
Good boy, Waldo, hey? Heart and lungs all sound good. I wouldn't be too worried about that sneezing. Certainly, he looks very bright, happy, energetic and inquisitive. There's no signs of any dehydration there. So at this stage, I just keep an eye on that.
The wombats are given a clean bill of health, but it's now their scheduled feeding time, and Lewis is getting a chance to help.
Is there any tricks to this?
Not really, just put it inside of the mouth.
Here we go.
He may not feed for you because they get used to one person, and so be a bit tricky.
Oh.
It's not as easy as it looks, Lewis.
They do tend to bond to one person only, so I think I'm going to struggle here today.
Friend, are you ready to go off to sleep?
On the Gold Coast, Alex and vet nurse Tiffany are about to perform surgery on 12-week-old Hendrix to clean up nasty bite wounds inflicted by a massive bull mastiff.
I want to make sure it doesn't penetrate into a body cavity, but I also need to clean out any infection out of the wound. What I'm going to do now is explore these bite wounds that I've found so far and make sure that it doesn't go into the chest cavity. While he's asleep, we'll go over him from head to tail, make sure we haven't missed anything. These ones under his neck, they look really superficial, but I said that before.
You never know.
Found that puncture wound, didn't we? So I reckon we take all of that hair off.
And see what's under there.
Yep. It almost looks like he's been scratched there, Tiff. It's just, that's nasty abrasions there, but there's nothing that goes full thickness through the skin. It would be quite painful.
Satisfied there are no more puncture wounds, Alex begins to explore the bite on Hendrix's abdomen.
You see that? I think I'm just going to make an incision, open that up and see what's underneath. It's really important to open up bite wounds because we don't know what's underneath. There could be hair, saliva, dirt. If I leave that behind, it's going to lead to a nasty infection.
How far does it go?
It looks like it's just the muscle, which is great. The major puncture hole that I was worried about, it doesn't go anywhere other than into the muscle. It doesn't go into the chest. That was my biggest concern. This is great news for Hendrix. It means he won't need any major surgery. I think he'll be fine. Okay. Yeah, it's great. Okay, let's close this down.
But just as they're about to close, Hendrix begins to take a turn for the worse.
Can we just do a Doppler on this dog? Yeah.
Yeah, definitely prefers the touch of you, Joan.
In Coleroy, Lewis is trying to feed baby wombat Waldo, and it's not going well.
If he's not going to take it from you, because I'm mum, I can feed him.
Joan made it look very easy with Wanda. Wanda sort of had that bottle without any issues, and Waldo was very unimpressed.
I'll swap you.
Yeah, there we go, Joan. The expert's going to take over and show me how it's done.
Hopefully.
Well, I'd say definitely. Here we go.
Yeah, can you got it? Got that
All
one?
right, yeah, I've got little Wanda here.
What I'd really like to see for these two wombats is that they get released back out into the wild and just be happy, healthy wild wombats.
Joan's an expert at rearing wildlife. I'm really hopeful that we will see Waldo and Wanda released back into the wild, and hopefully that they can bring up baby wombats of their own.
Moment of truth, Tiff.
On the Gold Coast, Alex and Tiffany are trying to finish Hendrix's procedure as soon as they can to avoid complications. But his blood pressure is dropping.
Just gone from 72 to 57.
Hendrix's blood pressure has been dropping under anaesthetic. Nothing too serious, but every anaesthetic carries a risk. And the sooner we can wake him up, the better.
You need to stitch up and get out of there.
You okay? Come together pretty nicely.
That's good.
It's time for you to wake up, my friend. Pop you back to bed and have a good night's sleep. Hopefully your mum's having a good night's sleep as well. It's been a rough day for everybody, I think. You're gonna wake up? Oh, now put powder on you.
You're okay, baby.
Hey, lady. You're awake. Hopefully when he wakes up, he'll just think it's all a bad dream.
Like a horrible nightmare. I hope he doesn't remember.
We know that Hendrix is going to be okay physically. What I don't know is psychologically what the damage can be. When puppies are attacked like this, it can really traumatise them, and it can affect how they interact with dogs later in life. Good boy.
Good boy. Come on, darling, here we go.
In Bondi, Dimitri is arriving at the practice with Border Collie Bernie for an appointment with Dr. Kate Adams.
I'm Bernie's dog nanny. Normally I take Bernie out in a wolf pack 5 days a week with other dogs, and we have a great time socialising and having exercise.
But Bernie has been in the wars.
Well, his mum rang me this morning a bit panicked, saying that he had a sore or a wound on his neck. She had to go to work, so she asked if I could bring him in, and I have. So we'll see what the vet says.
Hello. Hey, Bernie dog.
I'm Dimitri, I'm Bernie's nanny.
Have you got your nanny with you today, huh?
I haven't ever heard of anyone with a dog with a nanny. It's the first one for me. Dogs are really social creatures. They need humans. So I get lots and lots of really doted on pets, and I love that. What's wrong with you today?
Well, I think he maybe got bitten by Victor.
Oh, no.
Bernie's got a best mate in the wolf pack, and they're always constantly pulling at each other. Now, he's got an abscess underneath his neck there from all the rough play.
Oh, Bernie.
Come on, let's go have a look at you.
Cool. Come on, young man.
Dimitri thinks that maybe there's been some kind of an altercation. Come on, you guys. So could be there's some kind of a wound there. Do you know much about his history?
But I know that he was a rescue dog in California, so she got him from a shelter.
Let's just give him a bit of a check over first. I know, Bernie dog. Don't worry.
Good boy.
What's this one here? So now you take him to the park.
Yep.
You're his full-time nanny.
Yep.
It'd be like having a whole class full of primary school-aged children.
It's worse.
Really?
They're faster.
So we can't really see very well just because he's such a furry little dog. We're going to actually clip up that area and we're going to give it a good clean so we can get a better look as to actually what we're dealing with here.
Nurse Francesca will be assisting Kate.
And you can see he's quite anxious, so I'm trying to sort of reduce his anxiety as much as absolutely possible. I know it hurts, Chuka. I know it hurts.
It's okay.
So unfortunately, dogs don't know that what I'm trying to do here is actually help him.
It's all right, Bubba.
I know, darling.
It's
I know,
okay.
darling. Poor old Bernie, I know that he might find clipping a little bit distressing, but I do need a clear view of that wound. He just feels like this is really sore.
It's okay, look. There we go. Just relax. Oh, that looks sore. Does, doesn't it?
I can't yet tell exactly what's caused this wound, but I can see that it's infected. There's a whole bunch of pus underneath that skin, and it can be really painful. This is obviously by the hour really getting worse, and you can see that Bernie's very distressed about this. If left untreated, this infection is just going to enter the bloodstream and Bernie is going to become one sick dog.
It's not good, is it?
Slow down, fella.
Off we go.
In Melbourne,
to the vet.
Karen and son Xavier are arriving at the Kingston vet practice with their Labradoodle Molly and new addition to the family, St Bernard Crunch.
Good boy, Crunch.
Molly's a clinic regular, but this will be the first time Dr Danny Dusek is meeting big, lovable 4-year-old Crunch.
Hello, this must be Crunchy Boy.
We've had Crunch for about 2 months now, and yeah, they've been a very exciting 2 months. I love them so much.
Oh, you snobs, aren't you, eh? Oh, you're beautiful.
He got your arm.
He does that a lot.
Crunch has just covered me with his slobber love, but there's certainly a lot worse I have to deal with, so that's okay. All right, well, we might pop Crunch on the scales and see what he weighs in at today, hey? That's a boy.
Onto the scales.
Up you pop.
Good boy.
Well done. Oh my goodness. So we're I'm gonna say 69 kilos, you big boy, hey? Don't think I'll be picking Crunch up onto the table today. Yeah, I think we'll leave him on the floor. You're just a teddy bear, aren't you?
Crunch came to us from another family who had had him from a pup, but then they had returned to full-time work after having a young child and felt they couldn't give him the attention that he needed. So, yeah, we're very lucky to be the ones who could rehouse him.
Crunch has come to the clinic to see Danny for his yearly vaccination, and Molly has come along to keep him company.
All right, Crunch and Molly, come on through. Molly girl, you're such a sweetheart. All right, we're gonna try sit you up, okay, mate? Hey? Get under that chest of yours. Up your pop, mate. Up your pop.
As it's Crunch's first visit to the clinic, Danny begins with a physical examination.
Let's have a little look at you now, all right, mate? Now let's have a little look at these beautiful ears now. They don't look too bad. Now I'm just gonna have a feel of this leg. Yeah, well done. Oh, you don't mind about that. Have you noticed any limping or lameness at all?
No.
No? That's good. I'm just having a look at Crunch's elbows and hips. They're really important, particularly in your large and giant breeds because of hip and elbow dysplasia, and St Bernards do tend to be a bit more overrepresented as far as those disease processes go. It's possible that he could have a bit of mild discomfort going on in his hips that we're not seeing when he's exercised. Yeah. But just keep an eye on it for now.
Sure.
Alrighty, let's have a little listen to your ticker, hey? St Bernards can get heart disease. But Crunch's heart sounds beautiful. We've got no evidence of any murmur or arrhythmia, which is really good. We might do those vaccinations now. So we've got an oral component first and then go for the injection afterwards. Try not to eat my hand while we're there, all right, mate? So I'm just gonna squirt that into your gob. That's away. Oh, very good.
Good boy, Crunch.
Mightn't taste the best, I'm sorry.
With the oral vaccination done, Crunch now needs 3 injections.
All right, let's give some treats. Treats are the best distraction. If you want to be in charge of the treat giving up the front just while I'm giving that, and then he won't even notice.
More treats.
Good boy. The heartworm injection for Crunch is particularly big, so this one might be a little bit more ouchy than the first. Oh, I know, I'm sorry. All right, one last time. Oh, mate. Oh, you really cottoned onto that last one, didn't you, hey? I'm so sorry. I think Crunch has landed on his feet with you guys. I think he's going to have a really beautiful home, so...
Thank you.
It's a really generous thing to take on such a big dog. See you, Crunchy boy. You be good now. At 4 years of age, to give him such a loving home like they have, they're just really kind-hearted people.
We'll see you the same time next year.
Will do. See you later. All the best,
thanks a
guys.
lot.
Bye.
Hey, my man. Time to go home.
24 hours after being attacked by another dog, Hendrix is well enough to go home. He's being picked up by his owner's sister, Alexandria, and cousins, Alina and Joanna.
I think there's people here who want to see you. Look who's here. As I come into the consult room with Hendrix, there's family everywhere, and Alexandria is actually capturing the moment on her phone so she can share it with her sister, Melissa.
Who's that? Who's that?
He's made an amazing recovery.
After one day, Hendrix is looking so much better. He's bright, his tail's wagging and he's giving kisses. It's hard to imagine that yesterday he was brutally attacked. He must be sore, but you wouldn't know it. He's just got so much love to give.
He's been getting lots of cuddles, but I don't think it's quite the same as cuddles from his auntie.
Yuck. Yucky. He's looking so good. I'm so happy, and I'm so proud of my sister that she was so brave to stand in front of such a big dog. And he wouldn't be here today if that wasn't her bravery.
And really, he's been so happy. I mean, I know we were worried yesterday about whether he'd been traumatised, but honestly, he has been so great today. He's been good even around the other dogs, around all the people, so you know, I'm hoping that he can just put this behind him.
Really so.
How's Melissa doing, Alex?
As good as he is.
In protecting her puppy, Hendrix's owner Melissa has suffered severe bite wounds to her hands.
That's the thing that's been really stressful today. We don't know that she's going to be okay or if her hand's going to be okay.
She saved Hendrix's life. That's an incredible thing to do. He's a lucky little puppy.
I'm sending Hendrix home with a cone of shame. Now it's to stop him getting to the wound, but he's having a little bit of trouble getting used to it.
Hey.
He's exploring.
Hey.
We'll see you later. Hey, you take care, Mr. Frillneck Lizard. You stay happy. You gotta go and cheer your mum up. That's what she needs now.
All right.
Thank you so much.
See you guys. You take care, okay?
Stressing.
Just take that off.
At the Bondi Clinic, Kate and vet nurse Fran are examining a nasty skin infection on Border Collie Bernie's neck.
I know, sweetheart, I know it hurts.
In reception, Bernie's dog nanny Dimitri suspects the wound might be the result of rough play with another dog in his wolf pack.
I say the culprit's Victor because those two play 90% of the time together.
Now I've got a clear view of Bernie's neck. I'm able to see that there's not a bite mark and there's no wounds there. It means that Bernie hasn't been bitten by Victor. What we actually call this is a pyotraumatic dermatitis. That's also known as a hot spot, an area of infected skin that's really hot and really, really distressing for animals. They often happen around the collar. It's very, very painful. In Bondi, I usually see this in swimming dogs, dogs that love the water. It's usually caused from moisture, getting underneath the collar and rubbing.
Well done, sweetheart.
So I'm just giving it a really good clean, and we're going to actually start Bernie on some antibiotics, and we're going to get Bernie to not wear a collar for a little while. No collar and no swimming, Bernie. It's a very good thing that they came in this early. If it was left, this infection would just continue to get worse and worse and worse. It would have been a surgical job. This is going to be a little bit sore for Bernie for the next couple of days, but luckily, rescue dog Bernie is not going to need surgery.
Almost done. Almost done.
You know, he's obviously very anxious, and this is obviously really sore for him, and he's been such a good dog.
Come here, sweetheart. Come here, Bubba. Sit.
Good boy, Bernie.
Bernie needs an antibiotic injection, and then he can be reunited with nanny Dimitri.
Well done.
Hey, how you going,
glad
buddy?
to see you.
Thanks, Kate. How is
Worries. I just wondered, is he a swimmer?
he? Yeah.
Right.
He loves the water.
So what often happens with these dogs, and obviously being a beachside practice, we see this a fair bit.
Right.
It's going for a swim, and then the collar's like rubbed and rubbed and rubbed. It's ended up in a skin infection. But if he keeps going in the water, it's not going to get better.
So definitely no water for a week.
No water. Got pills to go home with. You've got some cream to put on twice a day.
Yep.
And the less amount of collar time, the better.
He's so well behaved, he doesn't need the collar, so that's good.
So good. I know. We're friends again.
Okay. You ready to go? Okay, there we go. Thank you, Kate.
See ya.
No, thank you so much. There we go.
Kate will be checking up on Dimitri and Bernie in a week to make sure they're both following doctor's orders.
Good boy, Bernie.
Do you call him Henny?
Yeah.
Yeah.
Henny.
Henny.
I feel like Hendrix is too big for him.
Yeah,
He's so
yeah.
small.
Yep.
On the Gold Coast, it's been a week since Hendrix and his owner Melissa were both badly injured in a vicious dog attack. Still recovering from her own wounds, Melissa has a special reason for coming in to see Alex today.
I did want to say thank you for taking care of him.
It was just a pleasure to be able to look after him. It was a scary time. Must have been a very scary time for you.
Yes, I was so concerned for Hendrix. I saw the dog bite him around the stomach. I didn't know what damage he had had. I knew that if he dies, he's gone. I can't replace him.
Hendrix looks like he's healing really well, but you've still got a battle ahead of you.
Yes, it's quite painful. They wanted to amputate my middle finger on my left hand, and the surgeon decided that I didn't need to lose my finger. He went in to fix the tendons, and I do have to do some physio afterwards.
So if you had the time over again, would you do the same thing?
Yes, yes, I wouldn't change a thing.
Even with everything you've been through with your hands?
Yes. Yeah. If I had to lose my finger, I was like, so be it.
Yeah.
As long as he was okay.
Yeah. I think you may well have saved his life that night. You're so brave.
Thank you.
Yeah.
I couldn't just stand there and just watch my puppy die.
Come on, you are keen to get out of here, aren't you?
Whenever I'm away from him for too long, I miss him. I love Hendrix. I love him so much. Thank you so much for seeing him again today.
Just, I think, wonderful to meet you, but also to see him, and he's so bouncing with life
He's
and
back to
happiness.
his normal self.
Yeah. Dog attacks are always horrific, particularly when they're on a little 3-month-old puppy. But this story is especially moving because of the bravery of Melissa in going in there and saving her little boy. This is one patient that I'll never forget.
Come on. Come on, Victor. Good boy, Bernie. Come on, guys. Come on.
In Bondi, busy dog nanny Dimitri has been following Dr. Kate's orders, keeping Bernie away from water so a nasty infection on his neck can heal.
Come on, Bernie. Victor. Victor. It's been a week since Bernie saw Kate at Bondi Vet, and he had that skin infection, and he's been back in the pack, but I've been keeping out of the water. It's hard because he loves it so much. Hey, Bernie Boo? We'll wait to see if Kate gives him the all clear today.
Dimitri.
Oh, hi.
Hello.
Hi, Kate. This is the
Hello,
wolf pack.
Bernie. Hello, my love.
I think the injury's almost healed.
Let's have a look at it. Bernie, can you sit down, mate? Such a good dog, aren't you? Bernie's such a good dog. Dimitri, this absolutely looks beautiful. Bernie's skin looks amazing. It's healed a lot better than I expected it to heal in such a short amount of time. All that's left now is to let him get back in that water. Come on, everybody. Come on, Victor.
Come on, Ben. Come on.
Looks like these guys have an absolutely outrageous time. Good to see him back with his bros, really.
No more restrictions for you, buddy.
Good boy.
Oh.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.